Hello everybody and welcome to the Tuesday edition of Video Clips, and as usual I'll start with an announcement. We have a wonderful package that is available right now for people who say, Dr. Pam, I want to learn it all. Everything you got to teach me, bring it on. So it's a package that includes the Diet and Lifestyle Intervention course, which has 39 continuing education units for doctors, physician assistants, nurses, nurse practitioners, dietitians, health professionals. And then the Food Over Medicine certification course, which authorizes you to teach the Food Over Medicine course to the public. It has Dell's Personal Chef certification course and business training for health professionals. So we packaged it all up and you save $1,338 if you just sign up for all four. All right, so if you're interested in that, send me an email at pampopper@msn.com. I'll send you more information and we can even set up a time to chat by phone if you would like more information about how this might help you build or start a health-related business, okay? All right, so I have a couple of things that are interesting to talk about, and I want to start with cognitive decline. I'm spending a lot of time on this year because it is such a big issue. Almost everybody I know has a family member who has some elderly family member who has cognitive decline or Alzheimer's disease. And more research is showing that although it's prevalent, it's preventable. As with all conditions, diet plays a role. I mean, when people ask me, is it worth it to change my diet? I don't see situations where it's not worth it to change the diet. But there are other things involved too, such as maintaining social connections and stimulating the brain by learning new things. Now, people who are able to develop and maintain both personal relationships and community ties have lower risk of cognitive decline. The study that I'm going to refer to, I've got several studies that actually show this, involved following older adults for 7.5 years, and it showed that those who had strong emotional support from social relationships at baseline had better cognitive health than people who had less such support. Another study involving over 1,500 adults showed that large social networks and high levels of social engagement reduced age-related cognitive decline. So seniors often tend to hibernate and isolate. Turns out that's really bad for brain health. Now, going on to another aspect of this, apparently it really is true that if you don't use it, you'll lose it. Your mind, that is, because, and the effects begin really early. For example, people who complete 12 or more years of education have better cognitive health as they age than people who've had less education. But if that pertains to you or someone you know, there is an equalizing factor. People with less education can protect themselves by starting or continuing to engage in stimulating mental activities such as computer games, crossword puzzles, and reading. In fact, one study that looked at over 3,300 adults showed that those with less education who regularly engaged in mentally stimulating activities were cognitively the same as those who had more education. So I guess the moral of this story is it's never too late and you're never too far behind to catch up by just doing the right things. Well, it's becoming more and more apparent that the things that we do in our younger years have a pretty profound impact and effect on our health and quality of life as we age. Now, I don't think most people put on their bucket list, hey, I'd like to lose my memory, develop Alzheimer's disease, and end up in some type of nursing home that specializes in that type of care. So they don't plan to do it. But the problem is that most people don't plan to make sure that those things don't happen. And so you have, I think the earlier you start doing the right things, the more protection you're going to get, not only in terms of brain health and cognitive function, but everything else. And also, I really think I want to reemphasize that, again, diet's important. We teach it to everybody who comes in here, and we don't think people are going to get a whole lot better if they don't at least pay some attention to it. This study is clear that other things are very important too. I don't think there are any studies on this, but my guess is that if you did a long-term study on people who ate perfectly, but they didn't keep their brain active, they didn't maintain good relationships and social connections, and they didn't exercise, that sort of thing, you'd probably find some levels of mental health or mental impairment, cognitive decline in those people. So younger people should be real mindful of these issues, and unfortunately it's kind of hard to convince them sometimes, but older people should be particularly mindful. As I mentioned earlier, and I've seen this happen with a lot of people, older people sometimes start to hibernate, isolate, withdraw from things just at the time that it is really, really important that they stay engaged. My grandfather worked until he was 94, 95 years old and died in his sleep. I think one of the reasons he lived such a long and healthy life was because he remained engaged. You know, he was not sitting at home, you know, just winding down. Bad plan. All right. I want to talk about how the mental health system worsens mental health. I mean, it's incredible to consider this, but I read a great article written by a naturopath in Canada. His name is Jonathan Prowski, and in this article, it's a long one, and I'm going to do some more of these video clips on it because there are many important points. But he says patients who have psychological issues get worse as a result of treatment. By the way, Prowski is the Chief Naturopathic Medical Officer of the Canadian College of Naturopathic Medicine. He defines the dominant mental health system as both inpatient and outpatient care involving psychiatrists, family doctors, all kinds of health professionals. And he says that the sooner that a patient gets away from these people, the better off he or she is going to be. The reason, Prowski says, is that the mental health system promotes a negative view of recovery. Patients who do try to become proactive and ask questions like, I want to talk about my treatment, I want to discontinue medication, or I want to look at alternatives, they're usually told there aren't any alternatives. You have to take drugs for the rest of your life. I mean, with a great degree of regularity, members tell us that this is what they've been told when they talk to their psychiatrists. And they're really discounted. And Tom Saws, a psychiatrist, wrote about this several decades ago in his book called The Myth of Mental Illness. He said then, and it's still true today, that there are no legally acceptable alternatives to biological psychiatry, where you get treated with drugs. Not surprisingly, Prowski says, patients get a little agitated when their input is completely discounted, and often this agitation is considered a sign that they need more drugs. Furthermore, a lot of the time what the psychiatrist is focusing on is drug compliance. And in my experience, and Prowski says so too, family members are drawn in to help with compliance, and if that isn't enough, the criminal justice system and social service agencies get involved in making sure patients take their drugs. Well, I'll tell you what, if I was one of those patients, I might be a little agitated too, all right? I think we can understand that. Because of all this medical involvement and focus on compliance, patients don't do very well, and in fact studies confirm this. Prowski cites a study in England that showed that intense community treatment involving compulsory supervision did not result in better outcomes for mental health patients. And Prowski says, and I agree, the only thing compulsory supervision does, and compulsory programs, is infringe on patients' rights. Well, even worse is involuntary commitment. We've had many Wellness Forum Health family members who've experienced this, which can range from a few days to several months or even years. Patients are placed in unfamiliar environments and drugged up, and if they refuse the drugs, then they're really considered pathological, and more awful things happen. They often lose their will to get well, and sometimes even their will to live. Prowski recounts the story of a patient who was involuntarily committed to a facility with violent criminals for 12 months and very heavily medicated. At one point, the family turned to him for help and invited him to attend a consent and capacity board hearing and present some alternatives for caring for this poor young woman. He was denied the opportunity to even speak about it. So, as Dr. Saz says, no legally viable alternative. They don't even want to hear about it. The woman was finally released, and get this, the mother helped get her off the drugs and then sent her to Iran to stay with family members to avoid another compulsory or involuntary confinement. Prowski says that this patient had a happy ending, but it doesn't always turn out that way. We see a pretty steady stream of people in here that it doesn't turn out that way. Long-term treatment, and I use air quotes, treatment with drugs can eventually result in permanent damage, making it almost impossible for patients to regain their health. So if you or a family member or a friend develop psychological issues of any type, and I prefer to refer to them as psychological issues, and our mental health guru, William Lessler, says he doesn't like to talk about people being mentally ill and anxious, like using those kinds of terms. But the best course of action is to avoid psychiatrists and other prescribing doctors. Interaction makes these people, with these types of professionals, makes people worse instead of better by turning them into helpless victims who require treatment for life. It's a heck of an annuity for doctors and drug companies, but it's a life-destroying practice for patients. So, you know, I guess the irony of the system is the people who you're supposed to be able to trust to help you are the ones who are most likely to hurt you. We do hear about some good psychiatrists out there. My colleague, Dr. Peter Bregan, is an example of one, but unfortunately they're pretty few and pretty far between. All right, that's all for today. As usual, if you know somebody who you think would enjoy watching this, pass it on, and I will be back to you again on Thursday with more news.